Welcome all. Our today's topic is about relationship of fetus to the pelvis. Once the fetus becomes stable near to the term, we should know how far the fetus is related to the pelvis. And this topic you can say otherwise called the fetus in utero. And this covers the term like lie, presentation, presenting part, attitude, denominator, and the position. First, we see about the lie. This refers to the relationship of the long axis of the fetus to the long axis of the centralized uterus or maternal spine. So, lie refers to how the fetal spine lies in front of the maternal spine or in relation to the uterine axis. When you see the picture A shows that the fetal spine is lying parallel to the maternal spine as well as to the uterine axis. In this case, we say the lie is longitudinal. When you look into the picture B, where the fetal spine is lying parallel to the uterine axis but not to the maternal spine. In this case also we say the lie is longitudinal only because this condition we can correct. This is happening due to lateral obliquity of the uterus, so we can correct this. That's why we consider in both these cases the lie is longitudinal. The other lie or oblique lie where the fetal spine is lying diagonal to the maternal spine or the uterine axis. And the last one is transverse lie. Here you can see the fetal spine is lying perpendicular to the maternal spine and the uterine axis. So basically there are three types of lie. One is longitudinal, another one is oblique, and the transverse lie. The cephalic and breech both are considered as longitudinal lie. The next is about presentation. This refers to the part of the fetus which occupy the lower pole of the uterus. So the presentation can be a head presentation, which is the very commonest one. 96.5% you can see the head presentation is very common. We say otherwise called cephalic presentation. The next commonest one is the breech presentation, which is 3% you can see. And the last one is the transverse presentation, which is uncommon, is about 0.5%. And you can see some abnormal presentations. Within the cephalic presentation itself, you can see vertex presentation, face presentation, and brow presentation. We consider vertex as a normal presentation. The other two, that is the face presentation and brow, are abnormal presentation, which is coming under cephalic. And you can see other abnormal presentations like breech presentation, where you can see the podalic pole of the fetus will occupy the lower pole of the uterus. And the next one is the shoulder presentation. This is happening in case of transverse lie. Next is about attitude. This denotes the relation of the different parts of the fetus to the one another. We say otherwise attitude as the degree of flexion within the head. There are different type of attitude. The attitude can be a well flexed head or it can be a deflexed head. We say otherwise called military pose, where the head will neither be in extension nor in flexion. And third case is the partial extension that leads to brow presentation. And the last one is the hyperextension that leads to face presentation. Even in case of the breech presentation, you can see the degree of flexion in the extremities that leads to different type of breech presentation. It can lead to frank breech, and it can be a complete breech, or else it can be a footling breech. And the different attitude of the fetus will bring different diameter as a presenting diameter in the beginning of the mechanism. In case of a vertex presentation, if the head is well flexed, you can see the suboccipitobregmatic 9.5 centimeter will become the presenting diameter. In case of deflexed head, you can see occipitofrontal 12.5 centimeter will be the presenting diameter. And in case of brow, when the head is partially extended, you can see the longest diameter of the fetal skull, that is mentovertical 13.5 centimeter will be the presenting diameter. And in case of hyperextended, that is in the face presentation, you can see the diameter submentobregmatic 9.5 centimeter will become the presenting diameter. The next is about denominator. Denominator talks about an arbitrary bony fixed point on the presenting part which comes in relation with the various quadrant of the maternal pelvis. So this fetal denominator depends upon the presentation, it will be different. In case of vertex presentation, occiput will be the denominator. Denominator says about the bony prominence which is leading. See, the occiput is the denominator in case of vertex presentation, and in case of breech presentation, sacrum will be the denominator. You can see in shoulder presentation, acromion is the denominator, and in face presentation, mentum, nothing but the chin is the denominator, and in case of brow presentation, the frontal eminence is the denominator. And this table will give you the nutshell of what are the different type of presentation, attitude and the denominator. You can see the various presentations like vertex presentation, brow, face, breech and shoulder presentations. And when you look into the attitude can be a flexed or deflexed or extended. And the denominator can be occiput, frontal, mentum, sacrum or the acromion scapula. The last one is the position. Position says the relation of the denominator to the different quadrant of the pelvis. The position can be either an anterior position or a posterior position. So when the denominator is facing the symphysis pubis, the anterior part of the pelvis, we say is the anterior position. And when the denominator is facing the back of the pelvis, we say posterior position. Again, the position can be either right or left. So in case of normal, we consider that the denominator is facing the anterior part of the pelvis. So in a vertex presentation, when the occiput is facing the any one of the iliopectineal eminence, we call the position as either right occipito anterior or left occipito anterior. Suppose when the denominator is facing any one of the sacroiliac joint, in case of vertex presentation, when the denominator occiput is facing, the sacroiliac joint, the position can be either right occipito-posterior or left occipito-posterior. Actually, there are 8 positions because we divide the pelvis into 8 segments with the angle of 45 degree. In case of vertex presentation, when the occiput is directly facing the symphysis pubis, we say occipito-anterior position. Suppose when the occiput is facing the right iliopectinal eminence, we say right occipito-anterior. Similarly, when the occiput is facing the left iliopectinal eminence, we say left occipito-anterior. When the occiput is facing the right iliopectinal line, then the name of the position is right occipito-transverse. And if it takes left, then the position is left occipito-transverse. When the occiput is facing the right sacroiliac joint, then we call it as right occipito-posterior. If it facing the left sacroiliac joint, we say left occipito-posterior. And when the occiput is directly facing the sacrum, then the name of the position is occipito-posterior. This picture will help you to understand the cephalic positions. And in case of podalic presentation, we call the position like this. Suppose the sacrum is facing the posterior, which means that in case of breech, the denominator is sacrum. So the sacrum of the fetus is facing the female pelvis sacrum, we say sacral posterior. If it is facing the symphysis pubis, we call the position as sacrum anterior. When the sacrum is facing the right iliopectinal eminence, then the position is right sacro-anterior. Similarly, to the left is left sacro-anterior. To the right iliopectinal line, we say right sacro-transverse. And to the left sacro-iliopectinal line, we say left sacro-transverse. And when the sacrum is facing the right sacroiliac joint, we say right sacro-posterior. And to the left sacroiliac joint, we call the position as left sacro-posterior. And in case of face presentation, we call the position like this. Here the denominator is the chin, or else we say mentum. So like in other presentations, even in the face also we have anterior position and posterior position. We call it as mento anterior or mento posterior. So when the chin is facing the iliopectinal eminence, we say the mentum anterior. When the chin is facing the sacroiliac joint, we say mentum posterior. Again, like in other presentations, here also there is a right mento anterior, left mento anterior, right mento posterior, left mento posterior. Similarly, the position names will come. That's all about the relationship of fetus to the pelvis. Thank you all.